We are back with more What's Now, and right now we are going to turn our focus to health and to infants. RSV is a big problem, especially as we head into the colder winter months. Let's find out more.
The country has been on alert since March due to the coronavirus, and as colder temperatures approach, parents may worry that their child may catch the common cold or flu. But many parents don't know about another contagious and common virus that is contracted by nearly all infants by the age of 2 this time of year. It's well known as RSV, and it can be very serious in babies and toddlers, especially in premature babies and other infants and children considered high risk. Here to help us learn more about RSV, the signs and symptoms to look out for, and how to protect little ones is Dr. Michael Forbes of Akron Children's Hospital. Dr. Forbes, thanks for being here today.
Thank you for having me, Christine. I appreciate it.
So describe, if you will, the healthcare landscape and what it's like this year, especially as we enter a new cold and flu season.
Sure. So, Americans, physicians and patients alike, are focused on COVID-19, and it's hard to not be focused on it. It's everywhere. It's in the news, and rightfully so. It creates a serious risk for many people. In addition, we have our regular seasonal common cold and flu season that's happening. But on top of that, healthcare providers like me are gearing up for the RSV season.
And what is RSV exactly, and why should it be on parents' radar this time of year?
Sure, great question. RSV stands for the respiratory syncytial virus. As you alluded to, it infects almost every child by the age of 2, and while most children have mild to moderate symptoms, preterm babies in particular are at high risk for serious disease. It turns out that preterm babies are about 5 times more likely compared to term babies to be admitted to the hospital due to RSV in the first 6 months of life. Furthermore, within that first year, we know that RSV hospitalizes kids in the first year of life about 16 times more frequently than the flu. Finally, in the first 5 years of life, we know that about 57,000 kids every year in the United States are hospitalized due to RSV. So it's very common, highly contagious, seasonal virus that we can predict every year is going to create a problem.
It's a very scary virus, too. Both of my babies had it when they were under 1.
Oh my.
So why are premature babies, though, at a much higher risk?
Wow, great question. So preterm babies being born early have immature lungs, and so they are more at risk for lung problems and infections. Furthermore, because they're born early, preterm babies don't get the full dose of infection-preventing antibodies that moms deliver to babies in that 3rd trimester. And so the combination of immature lungs and infection, just being more vulnerable to infection, sets them up for serious infections. So that's why I've partnered with SOBI to raise awareness about RSV. I think unlike most people, you're very familiar with RSV, and I think many people have never even heard of it.
And what are the symptoms of RSV, and how can parents know if their child is at risk?
Yeah, great question. Parents can know their children are at risk by talking to their healthcare providers to find out if their child is at high risk for serious disease. In that conversation, you also want to mention whether or not your child is eligible for some of the other preventative measures that are available, preventative options that are available for certain kids. We know that in addition to prematurity, kids with lung and heart disease are also at risk for severe RSV disease. When it comes to prevention, it's really fundamental prevention like we're doing right now. So washing your hands frequently, making sure that child is not exposed to ill children in your home. If your child's in daycare or if your child has older siblings who can go out and bring the infection home, you want to protect your child from that type of infection. And so it's very important to continue to contain that virus. And remember, we used to tell people to cough into your elbow. We don't recommend that anymore. Germs stay in your clothes, and your elbow is really kind of where you rest your baby's head. And so we recommend that you cough into tissues, napkins, discard them, and keep your environment as clean as possible.
There's a lot of anxiety when you have a baby, and now even more so due to the pandemic and worries about RSV. So what advice do you have for parents of little ones to protect their children from RSV?
Yeah, great question. There's a lot to worry about. The good news is we do know how to prevent this, right? So knowledge is power. And so while we can't treat RSV, prevention is absolutely critical. So I would make sure you have that discussion with your healthcare provider. Is my baby at risk for high-risk disease or not? And once you know that, then you can continue to prevent and, how we say, mitigate these days. The other thing I think is getting educated about it. And so there's a terrific website available for parents and anyone taking care of vulnerable children when it comes to RSV called rsvprotection.com. One word, rsvprotection.com. It's a terrific website that has the most up-to-date information on how you can prevent your children or grandkids, nieces, nephews who happen to be high risk throughout the entire season. And so again, I think this is a great time to learn as much as you can and partner with your healthcare provider about how to stay safe.
Well, thank you so much, Dr. Michael Forbes, for joining us today here on Park City Television, giving us important information about RSV.
Absolutely. Thank you for the opportunity to raise more awareness. I appreciate it. Thank you.
Thank you for watching this episode of What's Now. Be sure to tune in to Park City Television all day, every day at 8 a.m. You can watch Mountain Connections live. And remember, if it's important to you, it's important to Park City Television. I'm Christine Napier. We'll see you next time.